Hi YouTube, this is Natasha, Mrs. N. Burns. Today is February 22nd, and as promised, I am making a video to update on my plastic surgery consultation this morning, which I, excuse me, am extremely excited about. This was the second plastic surgeon that I went to see. I went to see Dr. Lytle through Oakwood Dearborn this morning. Um, he wasn't technically recommended by my doctor, but he's who my doctor was going to recommend. His office is actually one of his offices is directly across the hall from my surgeon's office. So, went in there and had a very good consultation. I really um, like him. He's very personable. Um, he took the time to answer all my questions, to explain all my questions. He sat and talked with me on three different occasions. He came in and spoke to me before I ever got undressed, and they did the pictures. Um, then his assistant came in and took the pictures, and then they came back in together, and he did measurements and went over the different procedures and what results he thought I could expect. And then I got redressed, and he told me to open the door when I was ready, and he came back in and asked me if I had any more questions, and we talked a little while longer. So all in all, very pleased, and I think based on the two plastic surgeons that I did a consultation with, he is my top choice, and I really don't think I'm gonna um, look any further. So my weight this morning, when I weighed myself at home, I was 163.8. Fully dressed at the doctor's office, I was 167. Um, and I'm fine with that for the most part. Excuse me, I just drank some water and I'll keep belching for a minute. Um, but the procedures that I went in to see him about, I went to see him about getting a breast lift and an abdominoplasty. Um, with the breast lift, and the main difference between him and the last plastic surgeon I saw, because I actually only saw her about a breast lift because she doesn't accept insurance from new patients. Um, but the main difference was she was sort of not pressuring me, but she kept, trying to get me to commit to getting implants, saying, I think you might be happier with implants, with a small implant, if you want more volume, blah, 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 blah. Where Dr. Lytle was a little more conservative in his approach, saying, maybe you should just go with the lift. He told me I'd probably end up being a large B, which I have no visual concept of what a B would look like because I have never been a B. My first real bra when I was in the fifth grade was a C. So I have no concept of what a B will look like on me on this particular body frame that I have now. Um, I don't know. But he seemed to think that I was small enough that a B would look okay. And let me say that before I lost weight, I have been a triple D, probably an F, but never got, professionally sized. The triple D was comfortable to me. I was in a 40 or 42 triple D. And the bra I have on today is a 36 double D. And in the last 3 weeks or so, when I've lost like 12 to 15 pounds, I have extra room in this. So probably a D would fit me now, but then again, it's skin. So he was saying I would be a B. And actually, at this point, having lost the volume and the weight, I don't really miss them. I thought, my breasts were me. Um, and I thought I would really miss them if I lost them, but I don't really care too much. So I think I'll be happy with a B. So he said, go ahead and get the lift, and then if you're not happy, we can always come back and you can get a small implant later versus getting a small implant, realizing that that's not what I wanted, and having to take it out and get a lift again because I would have stretched my skin out having gotten the implant. So that's what we decided on the breast lift. His fee to do a lift, his personal fee that he pockets is $4,200, and then I would have to pay um, for anesthesia and for the operating room. Okay. So then on to the abdominoplasty. What my insurance covers is the, I don't know how to say it, panic, whatever. Starts with a P. The removal of the pannus, which is the overhang of skin. That's all insurance covers. They don't cover the tightening of the muscle. They don't cover the replacement of the belly button. They don't cover um, them pulling your skin tight and stitching you up. All they cover is for them to cut off the excess skin that's hanging and to sew you back closed. He said, and some plastic surgeons will accept what insurance gives them and give you a full abdominoplasty. Some plastic surgeons are going to charge you an additional fee. The last plastic surgeon that I went to see, although she didn't give me a consult for the tummy tuck, we did discuss it a little bit because she was actually willing to take my insurance as long as I committed to getting my breasts done by her. Um, she was going to charge me. She said part of her, she would not just do the removal of the skin. She said she would do a full abdominoplasty, including liposuction. That's her procedure. And I would have to pay for everything insurance didn't cover. Dr. Lytle said he would give me a full tummy tuck, would tighten my muscles, um, replace my navel, no additional charge. He said the only thing he would charge me for was if I decided that I wanted to have the vertical extension tummy tuck, which I think some plastic surgeons call the fleur de lis tummy tuck. He said that is more extensive and involves more time. So for that, he would charge me the difference, which is $1,100, which isn't bad. Um, so anyway, upon examination, when he examined my stomach, the extra skin on my stomach, he said he didn't think that I would be completely pleased um, with how I would look on the sides if I got only the standard tummy tuck from hip to hip. He thought that I would get better results from the vertical incision, also the fleur de lis, because I have a lot of loose skin above my navel. And he actually pulled me pretty tight with his hands, and dramatic difference. So although that never would have been my first choice to go in and get an additional scar, you know, up my abdomen, it looked good. And if I'm going to pay money, if I'm going to go through pain, I'm going to, I want to be as pleased as humanly possible at this point in time. So my decision is to go ahead and get the fleur de lis. Um, and so for that, I have to pay $1,100. I don't have to pay anything on anesthesia or anything for that. So in total, it comes out to $8,200, which I so did not want to pay that much. $5,000 was going to be my limit, but I don't know. That's pretty much his fee for the breast is pretty comparable to what the other plastic surgeon was charging. So I'm thinking that's about how much it is in this area of the country. Um, so going to have to figure that one out. I'm committed to doing it. It's just a matter of coming up with the rest of the money. Um, but like I said, I was really, really happy with him and his office staff, and they're going to work with my bariatric surgeon to get some documentation to submit to Blue Cross, because I guess Blue Cross doesn't actually require um, Blue Cross doesn't actually require pre-authorization. They do the surgery and then they send in the claim. And so I suppose if it's not all right, then I'm pretty much stuck with that bill. Although I would take my sweet time paying it. But anyway, so that's pretty much it with the plastic surgeon. But I really, really liked him. He said he's going to meet with me 2 more times. He meets with all his patients at least twice before he performs the surgery. One requirement of Blue Cross is that I'm stable at my weight for 6 months at a 100-pound loss for 6 months. So around Thanksgiving time, I was at maybe 97 pounds, somewhere around there. He said that was close enough. So he said most likely come April, we can go ahead and schedule it. And he said they're scheduling anywhere from 4 to 6 weeks out. So I'm hoping by May I'll be able to get it done because he said a tummy tuck is about 4 weeks recovery. Um, but that was for the standard tummy tuck. I don't think I asked him the recovery with the vertical incision, but he said about 4 week recovery for that. And my plan is to go to New Orleans for the Essence Music Festival, fourth, not 4th of July weekend, but the first weekend in July. So I really need to be pretty much healed up. He said I'd wear a binder for, um, I think he said 6 to 8 weeks. I'd have drains for about a week to a week and a half. We talked about pain medication. I told him Vicodin is their standard. I told him Vicodin does absolutely nothing for me. He said the next drug would be oxycodone, which I'm not too, I don't know how I feel about that. But Vicodin really does absolutely nothing. So I'm the kind of person, though, I try to suffer through the pain, and when I can't take it anymore, that's when I'll take something. So I probably won't take it for very long. Um, as far as the muscle tightening goes for the tummy tuck, he said my muscles seem pretty good. He will check, once he has me open and see if they're out of place, if they need to be tightened. But he said if they're not really lax, there's no point in tightening them. And he said that's where most of the pain comes from. It's not the skin incisions, it's the actual tightening of the muscle that hurts the most. So if he doesn't have to do that, that'd be good. I won't have as much pain. Um, I think that's it. I think that's it. And then another thing, a side note, I have an obsession with shoes. I don't know if I said that on another video. I have an obsession that I cannot get over with shoes. And it's like last week I ordered 7 pair of shoes. Yeah, I ordered 7 pair of shoes last week. Ridiculous. I think the week before that I bought 2 pair of shoes at the mall. For what reason? I'm obsessed with heels and I'm obsessed with dresses. And I'm guessing it's just because when I was much heavier, it wasn't. I have a big foot. I wear a size 10. My foot got up to an 11 wide when I was at my heaviest. So it's really hard to find comfortable, cute shoes when your foot's that big, number one. Number two, when you are carrying close to 300 pounds, it's kind of hard to walk in heels for any length of time. So I didn't really wear heels. And because I didn't wear heels, I didn't really wear dresses. Plus, I didn't really like what I looked like in dresses, but heels and dresses sort of go together for the most part. So I think that's where the obsession comes from. Just not having been able to do something and now being able to do it. I'm really obsessed. And I bought the cutest dress and I bought these shoes that I am just absolutely in love with and cannot wait to wear, but it needs to warm up a little bit. But I'm going to wear them till I wear them out because they are so freaking gorgeous. And maybe I'll do a little photo thing because I've been taking a lot of pictures lately. And then I'll put a picture of my shoes on there too. But I don't know when I'm going to get around to doing that. I told my husband to upload my photos, but I don't think he did yet. Um, but that's it. That's my current obsession. And another thing, last thing, I have decided, I think I'm pretty comfortable at my weight. And I know when I do a body shot and when I look at myself on here, I don't think I look bigger than what I look like in person, even though I still sort of see myself bigger. I don't like when people say that I'm small because I don't see myself as small. And to me, I'm just average. I'm just regular now. Um, but everyone says that I'm small. Even the doctor and his assistant were like, "You're tiny," and especially when he pulled me in, tiny. And I've lost my freaking train of thought. Oh, and when I tell people how much I weigh, no one believes that I weigh 167 pounds. So I pack my weight in really good. And most of my weight is probably on the bottom now. As you can see, like my chest is flat up here. And then little boobs down there, but you can't see my boobs on the camera. But anyway, they're good. They'll work. Um, so I think I'm pretty settled at my weight. I definitely want to get to 160 on my scale here so that I'll be 165 when I go back to see the surgeon in March. But I was going to try and aim for 150, 155. I don't know that that would be a good look for me. I mean, if it comes off on its own, it comes off on its own, but I'm not going to pursue trying to lose, 10 more pounds, 13 more pounds. I'm not. Um, so that's that. Oh, and I have to get a mammogram too. I'm 33. I'll be 34 next month. Your baseline mammogram, I think, is at 35. But he referred me to get a mammogram because he said if, if they do find something, normally reconstructive surgery, one method of breast reconstructive surgery is to take skin and fat and muscle, I think too, from your abdomen and put it on your chest to make a breast out of that. And he said if they were to find something after I've had an abdominoplasty, then that rules out that particular procedure. So just to be on the safe side, and I mean, what's a year to go get your boob smashed? So I will be getting my boob smashed in the very near future. Um, and that's about it. I don't know how long this is. I really apologize if it's long because I had no intention on making it long. But have a good week, everyone. To everyone who commented on my last video about my supervisor and people making negative comments about my weight and my neck and my bones and my this and my that, I really, really do appreciate your comment. I just haven't been online to respond. But I appreciate your encouraging words, your compliments. I really do appreciate it because people do try to get in your head and say negative things, and it really does affect you and sort of throw off your motivation and make you look at yourself in a different light. So I appreciate that and I take it all to heart and thank you. So that's it for now. I will check in with you all if something fabulous happens, if I have another milestone or whatever. So toodles for now. Talk to you later. Bye.